Alright people, let's talk about high blood pressure in this video. So still, medications have not been able to cure high blood pressure, and there are many factors that have been associated with high blood pressure, which is trying to explain why we've still not been able to cure high blood pressure permanently with medications. So in this video I want to talk about one important factor that could explain why medications are not able to cure high blood pressure, and also offer my suggestion in the time to come on how we can possibly cure high blood pressure. So to start with, the first question is what is high blood pressure? I have some notes here that I'm going to read to you. So in high blood pressure, we are talking about the fact that the force or the pressure of blood pushing against the walls of your arteries are consistently too high. So when the pressure or the force of blood that is pushing against the walls of your arteries are too high, then we are talking about high blood pressure. Now, many factors have been associated with high blood pressure. So one of these factors is smoking. So there's a behavioral issue, it's a behavioral factor. So if smoking has been associated with high blood pressure, then just stopping smoking, or if you find it difficult to stop by yourself, seeing a psychologist or any therapist to help you to overcome a smoking habit or addiction will be the way to go. Another thing that has been associated with high blood pressure is becoming overweight. So there's also something that we can definitely do something about, making sure that we are physically active, we are exercising regularly, and this can help us control high blood pressure levels. Too much salt in diet. Well, there's also something that we can control. These days, we seem to be getting addicted to quite a number of foods that we eat, so salt can be one of them. And if you struggle with stopping the intake of excess salt, then that is something that you can see a therapist to help you to stop, and that will help control blood pressure levels. Talk about taking too much alcohol. We do know that alcohol has a lot of negative consequences on our health, from our brain to many other parts of our body. So then stopping alcohol would mean that you can control your blood pressure better. Or even if you struggle to deal with alcohol, then you might see a therapist or a psychologist to help you. Now, the most important factor for which I think it's been difficult to control high blood pressure, that is stress. While stress has been associated with high blood pressure, many studies now are saying that stress, would be able to lead to an increase in your blood pressure. However, when the stress reduces, then the blood pressure will return to where it was before the stress. But the question we ask is this: through environmental psychology, we've come to understand that stress is actually environmental stress. So far as we are in the environment, stress is almost always present. Talk about work stress, family stress, marriage stress, stress from friendships, stress from every part of the environment that we belong to. So literally, stress is almost always present in our daily lives. So maybe this could explain why medications are still struggling to cure high blood pressure permanently. So maybe in the time to come, the way to go will be to deal with stress, and then high blood pressure should be controlled to a large extent, and even possibly cure it. So then the question is this: how then can we deal with stress? Engaging in regular meditations, exercising regularly, avoiding alcohol, smoking, making sure that you engage in relaxation techniques such as progressive muscle relaxation. These are some of the things that we can do at this point in time to control our stress and therefore be able to deal with high blood pressure.